Hi, I'm Lauren Fraser. I'm a PEM consultant at Northwick Park Hospital, and I'm joined here today by
Ayia Al-Asadi, GP trainee.
And Mathura Sharma. I'm from the Young Harrow Foundation.
And we'd like to say a big thank you to RCEM for inviting us here to present on the Young Person's Wellbeing Guide that we've been developing together for the last 6 or 8 months. So this project all started out about a year ago when the emergency department joined forces with the Young Harrow Foundation, a local charity. We started looking at and working together to see how we could improve the experience of the children and young people that we're seeing in the emergency department. So Mathura, can you tell us a bit more about the Young Harrow Foundation and the role of the Change Champions?
Well, the Young Harrow Foundation are a local charity. We're a membership organisation working to support the local voluntary sector for the benefit of children and young people. The Change Champions are a body within the Young Harrow Foundation made up of young people that want to champion change in areas identified as the key needs of local children and young people.
So one of the first aspects of work that we looked at was the RCEM National Quality Improvement Project, Care of Children, and in particular Standard 3, that talks about psychosocial risk assessing 12 to 17-year-olds that are seen in the emergency department. Now, unfortunately, the first time that many children and young people in need come into contact with services is in the emergency department. The adolescent period can be a time for dramatic and rapid physical, cognitive and behavioural changes, and often new behaviours develop that can be both positive as well as negative. Adolescents are particularly vulnerable to peer influences, as well as the risky behaviours of those around them. As this slide shows, the most common presentations of adolescents to the ED involve trauma and poisoning, and 75% of mental health disorders have their origin before the age of 18. So it's really important that ED staff feel confident and comfortable to identify these young people in need, and then look at how they can support them, signpost them, and where required, safeguard them.
The health assessment itself is made up of various sections that address psychosocial well-being. These include things like home life, education, relationships, drug use and so on. The responses are graded from mild, requiring things like signposting to relevant resources, moderate, which can include referral to the GP, school, social services, and severe, which may include hospital admission and campus assessment if there's a high risk of harm to self or others. The assessment can be anywhere from 3 hours long if done thoroughly, or 15 minutes if used as a screening tool, and there has been good evidence to demonstrate its validity and effectiveness in clinical practice.
So from a clinical perspective, how do we go about trying to structure the psychosocial risk assessment?
So Lauren, you mentioned that you had come across the HEADS assessment being used in other parts of the country, and we also discovered an app in Southampton that was linking resources at the end of each section of the HEADS assessment. So we tried to find ways that we could incorporate this into the ED and enable young people to either complete the questionnaire via the app or through a paper format.
So how do we go about trying to implement this practically?
So we discussed the HEADS assessment with paediatricians, ED doctors, community mental health nurses and the safeguarding lead for the hospital, and decided to create a screening questionnaire that we could give to young people who entered the ED that they could fill in while they were waiting to be seen, and then the clinician who spoke to them could go through the answers and act on based on the results given. While this felt like a great idea in theory, actually we came across a few challenges when trying to implement it.
Okay.
One of the first challenges was staff training. When a young person enters the ED, they can be spoken to or dealt with by a number of different clinicians or practitioners, each with varying skills and ability to tackle mental health issues and feel confident and comfortable in asking some sensitive questions. So we would have had to create a robust training programme that could offer a standardised patient care and also be able to be replicated at every induction, every job changeover and every time a new member of staff joined the team. And this felt like a bit of a big challenge to address with the time constraints that we had. The second challenge we faced was the appropriateness of asking every 12 to 17-year-old really intimate questions, no matter what they came in with to the ED, and finding the right time to address this during their stay. And also the time challenge involved, as we said, it can take anywhere up to 3 hours, and how would we implement this practically during busier times of the year. And thirdly, we had to address parental involvement and their concerns. From the initial feedback we received, some parents felt it was irrelevant to ask such intimate questions or to have their child taken away from them and spoken to alone about these issues when they had come in for a wheeze or a stubbed toe or something.
So Mathura, can you tell us about how we address the standards set out in the Quality Improvement Project?
So we conducted some research in the hospital by speaking to clinicians, practitioners and patients, and we were able to identify key areas of concern. So one area of concern that arose amongst the clinicians was they were having difficulty signposting young people beyond the ED, and this is important because the young person needs to feel supported as soon as they leave the ED. So to solve this, we came up with the Young Person's Wellbeing Guide, which provided both the clinician and the patient with organisations and services they could approach so that they can help the young person. Similarly, they needed to feel safe speaking to someone within the hospital, so this was a concern taken up by patients. And to solve that, we put in youth workers by working with St Giles, which is a local organisation. And also another concern that patients had was that they were struggling to go through the adult ED because it's quite intimidating. So because Northwick Park Hospital don't have an adolescents ward, we created the adolescents room that we're currently sitting in, and that solved that issue. So by conducting the research, we were able to identify key areas of concern and then come up with solutions that we could put into action, which effectively should help the clinician when they are risk assessing the young person, because they would feel supported and they would be able to approach the young person as well.
So how did we go about addressing the challenges that you'd identified?
So as a team, we decided to create the Wellbeing Guide as a way to consolidate all the information available and offer it to staff and young people in the emergency department. When writing the guide, I was conscious of using language that young people would respond to and find acceptable and appropriate. I came across a really good website called We Can Talk that has great tips for how to communicate with young people, and I incorporated their tips when structuring the guide. So Mathura, can you tell us how we designed the guide?
So when creating the young person's wellbeing guide, we wanted a young person themselves to create it because they are the ones that are receiving it at the end of the day. So we worked with a young person named Malha, and we designed a series of leaflets which would form a booklet. Multiple considerations were taken into place, for example colour and how colour correlates to the topic being discussed, how it can engage the young person. At the end of the day, anything that went into the leaflet we had to make sure was information that we are conveying in the most efficient way possible, but also in a really engaging way, and that culminated in the final guide that you see today.
Fantastic. So Lauren, where are we at now?
So we've been printing the guides out and asking young people in the department to give us feedback, which as you can see has been overwhelmingly positive. There are some things we want to tweak, like including a few more helpline numbers. But we're also aiming to have an online version, so it will sit on the Trust's patient-facing website so that people outside the emergency department can get use of it as well. And we also want to address the needs of parents looking after young people with these potential concerns. So we're also writing a guide that's a similar fashion for parents. And then we're continuing with staff education around communicating with young people. As you mentioned earlier, Mathura, we now have a youth worker from the St Giles Trust who's doing small group training and talking to our staff about the importance of the language they use when communicating with young people. And we also promote the use and the training that We Can Talk have produced that's online. So if anyone has any questions about the Wellbeing Guide itself or the wider patient experience work that we've been doing, please do feel free to get in contact on that email address.
And we'd like to say a big thank you to the Young Harrow Foundation and the Change Champions team for all the work they've done.
And we'd also like to say a big thank you to the Heads Up team in Southampton, the We Can Talk team for their invaluable resources, and a big thank you to Malha for his great work with the designing of the Young Person's Wellbeing Guide.